Hi, I'm Cheri Johnson. Welcome to the Family Preservation Training. Today we're going to cover the Deliverables training module for Family Preservation Services. This will address those aspects of the FPS client service contract that are the specific items that you are required to provide in your service. I want to make sure that everybody's aware that the FPS contract, every part of it is equally important. Even those things that to you may seem negligible or not important. It's true that there are portions that are going to apply much more to your agency administrator than to you as a provider. Still, it's important to keep in mind that you need to have an awareness of what each of these requirements are. Before we get started on this training, it would be especially helpful for you to have already read the FPS client service contract, and as you're taking this training, to go through it with a highlighter and mark portions of it that are going to be particularly important to you. Some level of familiarity with this contract before sitting down and doing the training is going to make things make a lot more sense to you. Before you take the training, I want to recommend that you have the following items handy. First of all, your copy of the client service contract. Then, copies of the handouts that accompany this training module. We call some of them cheat sheets. You'll see why when we get to them. It's a good idea to have a highlighter, note-taking implements like paper, pen, sticky notes, whatever you usually use to take notes. Also want to alert you that whenever you see this symbol, it means that we're going to turn to one of the handouts or cheat sheets. So if you have them ready, pull that out, pull the form out that's indicated on the slide so that you can follow along with the discussion. I have a suggestion for you. When you read the client service contract, highlight everything that seems to pertain to you as a therapist. Here's a little hint. Many of these things will start out, the contractor shall. And anytime you see those words, it's a good indication that that the contract is going to tell you a specific deliverable that you need to be aware of. Take notes as you go through this regarding any questions that you might have. Because as you're taking this at home, there is likely not going to be someone there that you can ask questions of. So write the questions down, save them up, direct them to your supervisor, to the regional Children's Administration Program Consultant, or you can contact the FPS Program Manager in Olympia. A Children's Administration designated trainer would also be an appropriate option. Want to make a special note to all of you who may be contractors or providers using subcontractors. It's very important that you make sure that each one of your subcontractors has a copy of the client service contract and that they have read through it thoroughly and understand it. As a contractor, you need to provide both clinical supervision and administrative supervision to your subcontractors. Never forget that you are responsible for any oversights or omissions or outright errors made by your subcontractors because they were unaware of the contract. Now, the training module we're working on right now is going to focus primarily on the contract's Exhibit A, the Statement of Work. But just because we're not covering all the fine print, please don't think that means that you don't need to be aware of it. Are you ready? Let's go ahead and take a step-by-step look at what all is contained in the Statement of Work. Okay, first of all, in summary, the FPS purpose and goals. Family preservation services are committed to reinforcing strengths that the family already has. And the reason we want to do that is to prevent the possible out-of-home placement of any child that's in the home right now, or to expedite the earlier return of a child who's already been removed and placed in out-of-home care. In other words, to preserve the family unit. That's what family preservation is all about. Services focus on empowering families to solve problems, to become self-sufficient, and to strengthen relationships with community resources. Helping to improve family functioning really is what it's all about. It's critical to make sure that the health, safety, and welfare of children are in good shape, allowing them to remain at home and allowing the family to remain intact. Because all of us are aware that by and large, children do best when they're allowed to remain in their own families. Which takes us to family preservation values and beliefs. You know, I don't think any of us here would question that children need their families and they should be raised by their own families whenever possible. Most of us know situations where there was really no option but to remove a child from a home. But by and large, kids do best when they're with their own families. Interventions should always focus on family strengths, and they need to be responsive to each individual family's specific needs, to their strengths, to their cultural values, to their own individual situation. Child safety is our first priority. You will hear this again and again, not only in this training, but in just about any training that you will ever attend related to family preservation. And participation should be voluntary. This is a basic expectation, but you know, realistically, it's something that isn't always respected. It's not uncommon for referring social workers or for judges to order FPS or to require families to participate in it. That does have the unfortunate effect of sometimes taking away some of what makes FPS really effective. When families see us as their allies as opposed to another authority figure telling them, you have to do this, we're much more likely to be effective. They're much more likely to feel like they're our partner in this work. We believe in family preservation that all families have the ability to learn, to grow, and to change. This isn't new or innovative kinds of stuff. This is basic strengths perspective. Every family can change. That's why we're there. And we work in partnership with families. We respect their expertise. We invite their collaboration. We know that they know themselves. The parents know the children know the parents, they all know each other better than we possibly can. We may have expertise in lots of other areas, but they're the experts in their family themselves. So let's talk a little bit about required service outcomes. There are specific expectations for the work that we provide. In fact, the RCW lists 5 expected outcomes of FPS. Connection to community resources, no new referrals to CPS or FRS within 1 year of the FPS case closure, consumer satisfaction, and for reunification cases, reduction in length of stay in out-of-home placement, and a reduction in the level of risk factors that were identified at the time of referral. Now, the FPS client service contract basically takes that and translates it into a contractual requirement, which says that providers need to demonstrate when the case is closed that we've improved child safety and/or harm reduction, which of course go hand in hand, that we've helped to improve family functioning, that we've helped connect families to community resources, and that clients are satisfied with the services they received. So how do we demonstrate those things? How do we show that we've actually helped clients achieve these desired outcomes? Well, desired and required. There are several ways, and we're briefly going to talk about the methods we use to demonstrate that we've achieved those outcomes. The first is through the use of the NCFAS, the North Carolina Family Assessment Scale. And we'll talk more about this later on in this training. But the NCFAS is a set of scales that's used to assess family functioning, both at intake, when we first meet a family, and at exit, after the intervention is concluded. We compare the intake scores and the exit scores in each domain. Progress is indicated by improvement from the intake to the exit scores. The next way that we can demonstrate that we have met those required outcomes is through the Consumer Satisfaction Survey. This is a survey that's provided to each family, typically at the last client meeting. We provide them with this, ask them to fill it out, and then they send it in and they return it to Children's Administration. These surveys are completely confidential. You will never get to hear how your client felt about your work with them. The surveys are returned to Olympia, where the statistics are compiled. The results aren't linked with particular families, although they are linked with particular agencies. And then this data is compiled to provide insight with overall consumer satisfaction with the services. The last one is connections to community resources. One of the ways that you can make sure that you address this issue is to document thoroughly in the client file any referrals that you've made to community resources. And you also include this information in the monthly status report and in the client's exit summary. You're summarizing this information. You're also having weekly contacts with the social worker, so providing updates as the case goes along is something that's also taking place. Document, document, document. That goes without saying about all aspects of family preservation. But it's one way to demonstrate, to support that you have in fact made referrals, given clients information about available community resources. And again, this information gets provided not only in monthly status reports and exit summaries, but also in the quarterly reports that each agency provides. The FPS Program Manager in Olympia compiles the data that he or she receives from the quarterly reports, also from the exit summaries and the consumer satisfaction surveys. And that report is submitted to the Washington State Legislature. This data helps determine whether FPS continues to be funded. So obviously, cooperating with this requirement is really critical. Also, there's another aspect of this. If you, as a provider, can demonstrate success in achieving the required outcomes, it's one way that your agency's performance can be evaluated and actually can help to determine whether you continue to receive a FPS client service contract. Okay. The next thing I want to talk about in terms of a deliverable, a requirement, is the availability of services to clients. You know, I could sum this up really easily. You need to be available, or someone needs to be available to the client 24/7. That means after 5, before 8, on Saturdays, on Christmas Eve, on Easter, all the time. It doesn't necessarily mean that you yourself has to be available every minute. There is backup system and so on in place that we'll be talking about. The contract actually says the therapist and paraprofessional, if utilized, or the designated backup assigned to the family shall be accessible for all emergent situations. The contract also goes on to say, the contractor shall ensure consistency of services for the family by assigning a single designated therapist to provide services for the family. The contractor shall identify a backup therapist to assist each family as needed. What this means is every newly referred FPS family is assigned a specific therapist as well as a backup therapist. This is as opposed to the type of setting where, let's say you go to a medical clinic and every time you go in to see a doctor, you never know who you're going to be seeing. It ensures that the family is able to get to know you, to develop a connection with you, and if you're not available, they've met and feel comfortable with whoever is providing backup services. The FPS therapist, as well as the parapro, if you're using a paraprofessional, they will not be used in all cases, and the backup therapist. One of you three needs to be available to the family at all times in case of emergencies. So it's very important that your agency has a system for this crisis coverage in place. Remember that family crises don't always occur during business hours. So your agency has to be able to comply with this really crucial component. It's one of the things that helps make FPS a really useful service to families. Now, you need to keep in mind that FPS meetings take place at the client's convenience as per the contract, not at your convenience, not at the referring social worker's convenience. You need to be available also during those hours when problems can be seen and addressed, as long as the family agrees to meet with you at those particular hours. A therapist that I was talking to at one point had mentioned that a family that she was working with had a considerable amount of difficulty every morning getting their children off to school. The biggest family crises seem to occur between 6 and 6:30 every morning. So the therapist arranged to come over to the house between 6 and 6:30 every morning until they were able to work through some of these issues. Now, that may not be your idea of great working hours, but that's when the family needed services. So that's when the therapist was available. Now, I want to point out, the contract doesn't support the use of unannounced surprise visits. It might be necessary in cases where the family doesn't have a phone, because obviously you can't call ahead of time if there's no phone. But drop-in visits really should be avoided whenever possible. If the referring social worker feels that it's important to drop in unexpectedly on the client, they can do that if that's what they feel is necessary. But let me point out, if you've asked the client about making unannounced visits and the client says, yes, I agree, that makes sense, I want to show you that I'm doing what you're expecting me to be doing, then feel free to do those kinds of visits. Another aspect of availability is that typically we meet with clients in their own home, unless the family requests an alternate location. There can be other reasons why it might be a good idea not to meet with a family in their own home. Some of these possible exceptions might be for safety reasons. It may not be safe for you to be in the family's home. It may not be safe for them to meet you there for various different reasons. Or they may need to, or you may need to, access different types of equipment that's not available at the client's home, like a telephone, a fax machine, a copier, or something like that. Before we go on to the next topic, let me just say that if you do opt, or if the family requests that you meet somewhere other than their own home, especially if for some reason that alternate location ends up being your office, I would certainly clear that with the referring social worker first and actually get written authorization that you, the client, and the social worker have discussed this and agreed that a meeting or a certain number of meetings would take place in your office. Okay, next item, let's talk about caseload. When I first started doing FPS, I was actually thrilled to see that the contract limited us basically to no more than an average of 10 cases. That's because where I was doing FPS in another state, I sometimes regularly carried up to 16, 17, 18 cases. And you really cannot give each family the time, attention, and consideration that they deserve if you're working with too many families. Now, note that what the contract states is the average caseload must not exceed 10 cases per full-time FPS therapist. So there may be certain situations when you're carrying more than that or less than that, as the case may be. Now, the caseload size may be adjusted when parapros are used or if the therapist works less than 40 hours per week. Now, I mean works FPS less than 40 hours per week. So if you're a full-time employee of your agency, but part of your time is spent working on another contract, there needs to be an adjustment in the number of cases that you could actually carry. Also, any adjustments in caseload size must be addressed in the contractor's operating procedures. Now, if you're not an administrator, you probably won't you won't have any interaction in developing the operating procedures. That's something that each contracted provider must take care of. So, as I mentioned earlier, caseload size is also adjusted if you're providing services under some other contract. Also want to point out, you can, according to the contract, carry fewer than 10 cases at any time without worrying about violating the contract. Of course, your employer may not agree with that. You may not get paid to be a full-time FPS therapist unless you are carrying a full FPS caseload. That's between you and your agency. But at any rate, the contract does prohibit going above that average of 10 unless it's been pre-approved by Children's Administration. Duration of services. You know, one thing that you may encounter, the contract says quite specifically that each FPS intervention is limited to a maximum of 6 months. So occasionally when a social worker makes a referral, they mention to you, I opted to refer this client to FPS because now I know that they'll be working with someone for 6 months. That's not necessarily true, though. The case is open until the 6 months have been completed or the funds have been exhausted, whichever comes first. And there are also other conditions under which cases might close. So 6 months is the longest possible time a case can be open. But the actual average length of time that a case is open is several months less than that. Occasionally, families might be re-referred for services if a substantial risk of placement still exists and if the regional program consultant with Children's Administration approves the re-referral. Typically, no additional funding is allotted for that. If you do receive written approval from the referring social worker and the regional program consultant, you need to retain a copy of that written approval in the client file when services have been extended. Please note, if a case has been referred to you for reunification, the contract stipulates that the child who's out of the home right now, when you get the case, they must be returned. They must be reunified with the family within 30 days, or else you must close the case. And the contract doesn't provide any exceptions to that particular rule. So even if the referring social worker says to you on the 30th day, the child is supposed to come back next Tuesday, can we please keep the case open? I've gotten my supervisor's approval for that. You can't do it. You must go ahead, terminate the case. It might be referred or re-referred once the child is in the home. Now, we're going to spend a little bit of time talking about the authorization of services and referrals. It's not exactly complicated, but there are a number of things that it's very important for you to remember. So we're going to walk through this step by step, And in a few minutes, you'll turn to the cheat sheet that we've provided to help make sure that you remember all the important steps. The contract states that all referrals must be initiated in writing by a Children's Administration social worker. And all referrals need to be made on the designated form specifically for FPS. This is important because occasionally a referring social worker may call you up and make a referral over the phone, or may use an obsolete form or a referral form that's intended for some other type of service. If your agency is audited, if a contract monitor comes to review your files and you have a referral that was not made on the correct form, your agency is the one that will be penalized for that. So make sure that it's used, that all referrals come in on the correct form. If a referring social worker doesn't know what that form looks like, or they don't know how to find it, their Children's Administration regional program consultant can advise them as to where to get that. The referring social worker also needs to indicate on the referral form whether the children are at risk of being removed from the home, or if they're already out of the home and in need of reunification services. There is a place on the referral form for that to be indicated for each child identified as being in need of services. Now, this is straight from the contract. The contractor shall not accept a case without a complete written referral on the CA-designated referral form. So let's talk about what complete means. Complete means, first of all, using the designated referral form, is signed by the supervisor, and includes all required documentation. Okay, so what does all required documentation refer to? We will get to that in just a second because it's a little bit complex. But we need you to keep in mind that social workers, by and large, have very large caseloads, larger caseloads than you do. They also have many, many service contracts that they can possibly make referrals to. They do not get the extensive training on each contract that, for example, they would not sit through a contract, they don't have time to sit through a training like this one, where we're going through the contract basically item by item and explaining what they mean. So they will typically have a general idea what family preservation is all about, but they will not know all the step-by-step parameters. Therefore, you have to be the expert in this area. So we do have a cheat sheet to help you and also to help them. In fact, one of the reasons that this table was designed was to give to social workers to help them know what's expected when a referral is being made. So let's take a look at the referral and intake process handout. Okay, you'll note that on the left-hand column, it lists contractual requirements, and on the right-hand column, it lists the steps that must be taken to ensure that the contractual requirements are fulfilled. So in just a nutshell, what this says is, first of all, the social worker meets with the family, gathers the necessary information, makes a suggestion to the family about family preservation services. Hey, there's this great service called family preservation. You might be interested. A therapist could actually come to your house. You don't have to go to their office. They will try to help you make sure that you can keep your children here at home with you. And the family agrees. Now, ideally, that's what happens. Next, the social worker goes back to their office and completes the referral form. Probably, typically, they'll talk to their supervisor first because filling out the referral form takes a little bit of time. The bottom line is, though, they need to run the case by their supervisor to make sure that the supervisor agrees with making a referral to FPS. If the supervisor agrees, they sign off on the referral form and attach the necessary supporting documentations. Okay, you will notice where it talks about the necessary referral information that needs to be attached in the right-hand column there. The referral form contains, on the second page of it, a little checklist, and it asks the social worker, was a safety plan completed? If so, it needs to be attached. It also asks about and that's a Children's Administration safety plan. It also asks about a reunification assessment and a transition and safety plan. And the social worker needs to check one of the boxes, yes or no. In case of referrals that come from CPS, and these would typically be cases that are where the children are at risk of removal from the home, at risk of being placed in out-of-home care, then the social worker will almost always have completed a safety plan. If they did, they must attach a copy of it. And you cannot start working with the family unless that's attached. If it's a reunification case, that means the child is already in out-of-care placement. Could be in foster care, could be in group care, might be in some other type of institutional facility. And prior to releasing that child to come back home, the social worker, and we're usually talking about a child welfare services social worker, will have completed a reunification assessment and a transition and safety plan. If they have completed that, which they should have in all reunification cases, you must receive a copy of it. It must be attached to the referral form. Okay? So, back to looking at these steps and what is necessary, what is the required documentation. If the social worker has checked any of those boxes, yes, that appropriate document must be attached to the referral form. Okay, so back to the step-by-step referral process. Assuming now that the referral packet is complete with the attached documentation, the social worker and or their supervisor decide which provider they're going to send the referral to. Typically, they'll decide this based on the family's needs and what the agency's strengths are, providing agencies. So if your agency specializes in working with families with challenging adolescents, then if that's the needs of this particular case, they may make the referral to you. If your agency specializes in working with family members with mental health issues, and that's what's going on in this particular family, then you might get that particular referral. Sometimes in small communities there may only be one providing agency out there, and then all of the FPS referrals go to them. Or it could be that every provider in the community is full. They have all the cases they can handle. It's up to the social worker and their supervisor to determine who the referral is going to go to. Now, ideally, what we like to see happen is then the referring social worker contacts the provider they want to send the referral to and asks them, can you take this case? Maybe they will share some information about the family before faxing it to you. If you agree that you would like to take this case or that you would be available to take it, then they fax the referral process or packet to the provider. And at that point, an imaginary clock starts ticking because the provider then has 48 hours to make face-to-face contact with the client. So let me ask you, it's a fairly complex process. Do you have any questions about what is involved in the referral process? Yes, question.
If the referral form checks no for safety plan or reunification assessment, are we able to accept that?
Yes, that's a very good question. If the social worker has checked no on those, then you're not expected to have any accompanying documentation. However, it does bring up another good point. If the social worker did not check either yes or no, then your job is to contact them and to ask them specifically. And then, even though I usually advise people do not write on that referral form that comes to you, in this particular case, once they tell you yes or no, I would go ahead and check the appropriate boxes. Now, keep in mind, if they checked yes, or if you found out that yes, they did do one of those documents and they didn't send it to you, you cannot start working with that family until you have that specific document. Now, when you receive the referral, first thing for you to do is to make sure it's on the correct form, check for the supervisor's signature, check whether they've indicated, whether the referring social worker has indicated for each child identified, are they at risk of placement or in need of reunification. Also, check whether they checked yes or no to indicate completion of any of those documents. If any one of those items that I just listed is missing or incomplete, you need to contact that referring social worker immediately and let them know you can't start working with the family until you have that. Okay, this is a great place to take a break. So why don't we pause here?